a couple TikTokers request a discussion on the Lisfranc injury, so I'm going to do a Lisfranc talk today. The Lisfranc injury is an injury to the foot that you have to be thinking about when you're diagnosing it. Have that in your differential diagnosis. I'm going to go over some x-rays. I'm going to talk about the mechanism of injury and then the treatment. But first, I want to refresh everybody's memory of the anatomy. This is an x-ray. This is an AP of the foot, and this is the normal anatomy. And these are the different bones of the foot. And what's really important is this is the first metatarsal, the second metatarsal, the third, and they snug up to the medial cuneiform, the intermediate cuneiform, and the lateral cuneiform, which then tucks into the navicular. And all of these little bones in this area are connected with little tiny ligaments. They're not drawn on this photo, but there's little tiny ligaments that hold all of these bones together. Again, this is a normal AP of a foot. You can see how all the bones line up. This is a patient with a Lisfranc injury. I want you to look at this clear space between the medial cuneiform and the second metatarsal. See how there's a space there? Go back to the normal x-ray and see how there's almost no space in that area. The Lisfranc ligament lives between your second metatarsal and your intermediate cuneiform and also your first cuneiform, and it is a broad ligament and holds all these bones together, and when it tears, this area will widen. I'm going to show you another image. This is a normal foot. This is a patient with a Lisfranc ligamentous injury. You can see the widen of that space. Another way to also check for Lisfranc injury is look at the medial side of the second metatarsal. It should line up with the intermediate cuneiform. And see how it doesn't? That is another way to diagnose a Lisfranc. So there's two different ways. You can see the clear space is widened, and also you can see where this doesn't line up. Now you can't always use this method because if you look at this x-ray, you can see this actually does line up, but you see this clear space compared to the normal x-ray. And I'm just going to show you a couple more examples because this is really important that you can identify this widening the clear space or where there's the second metatarsal is not lining up with the cuneiform properly. Here is another example of widening of the clear space in this area. And this is an example of a normal foot. This is a normal Lisfranc area. This is widened. Here is another example of a normal Lisfranc joint, and you can see where this area is widened. I want to talk a little bit about the mechanism of injury. We see this commonly in patients who have some sort of trauma where their foot is in a plantar flex position and somebody lands on the heel. Football, soccer, work-related injury. This is the mechanism. The foot is plantar flexed. A force comes down on the foot, which can injure all the ligaments and potentially fracture in this midfoot region. Here is a fancier picture. You can see here's the axial load coming down. Here is your navicular. Here's your second metatarsal, and this is this whole Lisfranc area where the metatarsal pops out the front and the Lisfranc injury tears. They will have a very specific look to them when you see them in the office. You'll see bruising and ecchymosis on the plantar aspect of their foot and also usually on the dorsal aspect of their foot. Lisfranc injuries are treated many times surgically where we have to go in there with screws and plates and pull that Lisfranc joint back together. Sometimes a Lisfranc injury is also associated with fractures of the other metatarsals, and that has to be fixed. I pulled this off the American Academy of Orthopedic Surgeons website. This was a patient with more of a ligamentous injury. This patient had a ligamentous Lisfranc injury in addition to fractures, and this is a patient with multiple fractures and a ligamentous injury. Remember, if a patient comes in with that type of mechanism, be suspicious of a Lisfranc injury. Get x-rays of the foot. If the x-rays look normal, but you're still suspicious, you may want to get weight-bearing x-rays of the foot. If that comes back normal, but you're still still suspicious, I move forward with an MRI scan. The MRI scan will show if that Lisfranc ligament is torn. You do not want to miss this injury, because if you miss this injury, that can cause accelerated early arthritis in the midfoot and cause problems for this patient lifelong.